Welcome, friends. We are going to give it just a few minutes to let people sign on. We are so thrilled that you are here with us today. This is such a joy. Give us just a few minutes and our team will get started. We are so excited. Let's see. Here we go. All right, we are going to start. Hi, everybody. While people are joining us, we still have a minute to go. So at 8 o'clock, which it is now, we're going to give a couple minutes to let people join us. And we'll introduce ourselves. I'm Dr. Rachel Rubin. I'll introduce myself more later. But as people are joining us, we're going to start with an icebreaker. Now, remember, you are all anonymous. Nobody knows who you are. Your names do not pop up at all. If you're scared to answer these questions, it's okay. You don't have to, but none of your names are on this. We are so thrilled that you invested in yourselves tonight to join us, to care about this stuff. I'll tell you, flowers come and go. Chocolates get eaten real fast. But if you're here with your partner or you're here with yourself to learn something, you should be so proud of yourself that you invested in you and you invested in your knowledge, which is just the most beautiful thing in the world. So let's see, let's start with the first question. Let's see if I can figure out my Zoom buttons here. Have you ever tried couples or sex therapy? Yes or no? Let's see. Do we have newbies here? Do we have people who've tried these things before? I'm going to give it for anyone just joining us. We're going to start with a couple icebreakers and see what you have to say. We're going to wait a couple seconds. Have you ever tried sex therapy before? All right, we've got quite a few respondents, so we're going to end the poll. And I'm going to share the results. So we've got some people, Brooke, who have never done this before, right? 68% of people have never done this before. Are you surprised by that answer?
Not at all. Not even a little bit.
Not even a little bit. All right. So for anyone just joining us, we're going to go to the next icebreaker here. Now, remember, you're all anonymous. Nobody can see your name. No one can see your answers. Have you ever used a device in the bedroom? Have you ever brought in something that vibrates? Have you ever brought in a constriction band? Have you ever brought in a dilator or something that just seemed like an adult toy? Let's see. We've got quite a few people who are answering. And for anyone who's joining us, we're going to get started soon. We're just doing an icebreaker to let everybody come on in. Now, the chat is disabled. If you need to tell us something, you can chat us, but we're not letting you talk to each other tonight. This is an anonymous night where we're all going to have some fun. All right, we've got a lot of answers here. And I'm going to end the poll. All right, so let's see what we had. Have you ever used a device? We've got 40% never. Well, welcome tonight, my friends. You've learned how to use a computer. You've made it this far. Maybe you can learn how to use a device in the bedroom. Sometimes, depending on the partner, often 19%. And we've got our 18% who have their toy chest. I love this. I love this. What do you think of this, Brooke?
Yeah, I mean, I'm definitely not shocked about the never, but I love the, 18% who've got a toy chest. That's very encouraging. That's
And
great.
don't get intimidated if you don't have a toy chest. I had just a couple patients this week who said, you know what? I'm ready for one. I'm ready for the first device. What do you recommend? So today we're going to give some recommendations, which I'm excited to do. Okay, for everyone just joining us, we're doing some icebreakers. We've thought, have you ever done sex therapy? The majority of you said no. Second question, do you ever use devices? The majority of you said sometimes, it depends. And then let's see, the next question. Oh, it's not letting me launch this question. I don't know what happened. Hold on, let's see if I can get this one to launch. For some reason, they're not working. So we had our options. Maybe we'll get them back. Maybe we'll edit those and get them back later on. We were gonna ask, oh wait, hold on. Someone on my team just found the button. When do you like to be intimate with yourself or with your partner? Morning, midday, nighttime, middle of the night? All day, every day, there is no time with which I do not want to do things. Let's see how many of you answer. Remember, y'all, it's anonymous, so no one's judging here. Although if you're sitting next to your partner, this may be a conversation starter.
Mhm.
I'm gonna wait 2 more seconds. All right. Let's see. We've got 27% of you are doing it right, by the way, because morning sex biologically is the best sex. Your hormones are raging in the morning. You're well rested. You're not thinking about the whole day. morning is where it's at. Midday for 16% of you, 45% of you are nighttime people. That is not surprising. 10% of you are my hyper-focused, I want it all the time folks, where it is challenging to keep you satiated. And then the 1%, the middle of the nighters, that is a thing. There are people who kind of have this dream sex that they're like half asleep, half awake. It's a thing. I'm not surprised by these results. What about you, Brooke?
No, but I do love to see that 27% in the morning because that really is so much of what we hear is that by nighttime, people are just tired, right? And so sort of get it in early. I really like that.
This is where I like if you have small kids, you get the cereal downstairs, you get the TV on, or you get them with the babysitter early, you get them out of the house or have a lock on your door. Those can often save couples and relationships. I think I did this, shared the results, stop sharing. Let's go back. All right, last one. This one is important, actually. I want you answering this, you anonymous people out there. How frequently do you masturbate, which I hate that word, self-pleasure, have an orgasm solo? You can use a device or not. We don't care about that. And if your partner is with you during this, I actually am excited if you answer. Now, it's going to be hard because which one of you answers? If you have multiple partners in the room, I don't know which one of you is going to answer. But we find couples never talk about this. They know if their partner's constipated and like they know their golf score, they know their macros, how many macros and grams of protein they've eaten, but they have no clue if their partner masturbates. What do you think about that?
Yeah, I mean, I'm always shocked that people have been married, or together for 30 years or 40 years, and that has never come up once, which means just because it doesn't actually just come up in conversation, that they're not talking about it. And it's really important because masturbation is sort of the birthplace of sexuality in a lot of ways.
I mean, how do you know if you don't know your own buttons, how's your partner going to know your buttons? So what did people say? 11% just don't do it, right? And there's something wrong. If it's not a comfortable space or you don't want to do it, we're not here to force you to do it. A few times a year for some of you, once a month for about 22%, once a week for about 42%. And we do see this, right? This idea of, does it give me a release, a relaxation? I have patients, it helps me fall asleep at night. I'm reading a book and it's all these spicy books out there right now, right? I just need that release and then I can go to bed. It's not always sexual or intimate. Sometimes it's just a stress relief.
Yeah, I think that's huge. I mean, I always tell people, talk about, there's so much insomnia, talk about a sleep aid. A great orgasm right before you go to bed is amazing.
All right, so that ends I love that we did that. What a fun thing that we did our icebreakers so that you all got to know each other and know that you're all different. You're all starting from a really different place. So I'm so grateful that you're all here, that you've invested in you, that you've said, I matter, my quality of life, my pleasure matters, and I want to learn about it. I want to learn how to communicate about it. So I just want to say you are all welcome. Come one, come all. This is for everyone. Anybody who is here belongs here. If you're having sex with nobody, with everybody, we don't care what parts you have. We care how you want them to drive and if you are optimizing your quality of life. We also know that many people have trauma. Many people have really hard stories, and we're not here to solve all of that today. We're here to give some tips and tricks to get you to better understand your body and better understand your communication skills. And as I tell my patients all the time, I can't possibly know everything there is to know about you from a cultural, religious, or a trauma perspective, and you have to teach me. If you don't teach me what your boundaries are, what your goals are, what you care about, what your culture is, I can't know how to help you. And so again, today we're really going to dive into the biology. I'm going to talk about sexual medicine, about what it is that we do, about how your body is changing. And then we're going to dive into the most important part, which is really understanding sex therapy and communication, which is all why you are all here. I promise we're going to give you tons of tips. And if you stay long enough, there will be a raffle where we will get that first device out to a happy customer. And we'll make sure we have lots of time for Q&A. We'll make sure of it, even though both of us can be long-winded, but we are going to do our best because we truly want you to know everything that we know. So who am I? I'm Dr. Rachel Rubin. I'm a urologist. I did a fellowship in something called sexual medicine, and I own my own practice in the Washington, D.C. area and work with 3 incredible urologists and urogynecologists. We take care of everyone. We do libido, arousal, orgasm, and pain, and we do it through a biopsychosocial lens. So we really care about the biology, but we also deeply care about who you are, what your story is, and how we can work with a multidisciplinary team to get you the best optimal quality of life that we can possibly find. I truly believe that everyone can have better sex through education. And the things that I care about most are research, education, advocacy, and mentorship. So you'll see that I have a passion kind of bursting through my ears, but it is all well-meaning and well-placed. And so hopefully you'll learn something tonight. And then we'll let Brooke introduce herself.
Hello, good evening. My name is Brooke Bralove. I am a licensed clinical social worker and psychotherapist. I'm also an AASECT certified sex therapist and a master accelerated resolution therapy practitioner. I specialize in treating adults, couples, groups with anxiety, depression, trauma, and sexual and relationship challenges, which is most of us. And I have been in private practice just outside DC in Bethesda, Maryland for over 20 years.
You look too young to be doing anything for 20 years. And Brooke was one of the first people who welcomed me to the community when I came to Washington, D.C. in 2017. And we have been close colleagues and friends ever since. And I'm so blessed because in our area, we just have such an incredible community to work with. So I'm going to start off with the sexual medicine side of things. I want to dive into the biology because it's not enough that sex is hard for people to talk about, that they don't know what's going on, even when everything is quote unquote normal, right? But nothing's ever normal. There's no such thing as normal. And biology changes through the lifespan. So like babies don't have the same genitals as teenagers, as grown-ups. And then as you go through changes as you get older, everything starts to change and the biology changes. And if you're not good at talking about sex when you're in your 20s, right? It only gets harder and harder when you're in your 80s. And so giving you that framework of thinking about the biology, and I actually find that people can talk about high blood pressure and diabetes with their partners, but they can't always talk about, hey, honey, a little to the left, that thing that you used to do, it doesn't work anymore. My body has changed. Why can we talk about diabetes, but we can't talk about that? So as a doctor, I really do 4 things. I deal with issues of libido, arousal, orgasm, and pain. And so we're going to go through each of them and really talk about how they change and how the biology is so important. So libido is your interest in sex. And many of you will complain of low libido and say, I'm not interested, or I'm not as interested as my partner. We have a different interest level. And society loves to blame the low desire person. It's all your fault, like you're doing something wrong. And we should all, raise up to the higher libido person. Now, the reality is we also like to think it's all psychosocial. It's all about communication. It's all about the relationship. It's all about, the intimacy stuff, which it's so important. And we're going to spend a huge chunk of this webinar talking about it. But I'm here to say there's a heck of a lot of biology involved. And so we like I always say, like teenagers, they don't have deep, meaningful conversations, and that's why they are horny. They have huge surges of biology and hormones, and this is dopamine and testosterone and estrogen and just raging hormones and neurotransmitters that cause this high libido in these teenagers, right? I did sex ed for a bunch of teenagers recently. They're not having high level discussions. This isn't like a really high level group. So it's really important that you understand that there is so much biology. And as you may hear me say all the time, is when you play with hormones, there are consequences, sometimes good and sometimes bad, but there are consequences to your libido as we age. And we do so much in medicine to screw up hormones or to mess up hormones, or things like menopause, perimenopause can affect your estrogen, your testosterone levels. Birth control pills can cause it. Acne medicines. When you're breastfeeding, you're going to have lower hormones. If you have disordered eating or you've had surgery and had your ovaries removed, breast cancer therapies can be incredibly harsh to the libido. And we see tons of issues, hair loss medications like finasteride, prostate medications, antidepressants, sleep apnea, smoking, you name it, it can affect your libido. We're doing a study right now on GLP-1 medications to say, how do those affect the libido? Because we have a lot of patients who are saying that Ozempic, man, I'm lost a lot of weight. I feel great, but I have no libido. Now, we also have to know that estrogen is not a female it's not estrogen for girls and testosterone for boys. In fact, when women are in their reproductive age group, they have way more testosterone and androgens than they have estrogen. And so women are testosterone-driven beings, men are testosterone-driven beings, and we have to get comfortable knowing that testosterone is very helpful for libido, no matter what gender you are. It's just that we have FDA-approved testosterones for men, nothing for women, so we have to steal from the men and use it in the right doses for our female patients. And when your hormone levels change, this is an empty gas tank. And I can't tell you, when your gas tank is empty, no matter how much you want to drive to the beach, you're not going there, right? You can step on that pedal as fast as you can, but if your gas tank is empty, it will not go. And so while we're talking about these tips and tricks of how to get more in the mood, sometimes you need gas in your tank. So if you're in menopause and you take an antidepressant and you're stressed to high heaven because of current events and you've got X, Y, and Z and you're taking care of aging parents and young kids, you have negative gas in your tank. Like, it is getting siphoned out. And so it's kind of a framework with which we think about these things. So we have medications, and it's not that it's a one pill is going to make your libido perfect. It is biopsychosocial. It's we try to add gas into the tank once we get to know you to figure out what we can do. So for many of our patients, we use hormone replacement therapy like estrogen, progesterone, testosterone. For my male patients with low testosterone, we add back testosterone. And when you can fill that gas tank, my goodness, the energy comes back, the libido comes back, the warmth comes back. It's really a beautiful thing to see. We even have FDA-approved medications for low libido that work in about 60% of our patients who take them. These medicines don't work if your partner is awful and you should get a divorce. Like, that doesn't fix that situation. But these medicines work on dopamine to build it in your brain. So if you can agree with me that antidepressants can cause low libido, which we have lots of data that they do, these are medicines that can boost libido and offset those side effects and offset those issues in the brain. And they work quite well for our patients. We even have some luck with off-label medications like Wellbutrin or Buspar and things like that. So we have medications that really can help with libido. So and libido problems are common, but arousal problems, my goodness, right? Erectile dysfunction and decreased arousal to the clitoris, it's actually the same thing. So we all know about erectile dysfunction because it's all over the news, it's all over the ads and things like that. But actually, the clitoris and the penis are exactly the same thing. They're made up of the same tissue. They work the exact same way, which is why it's funny, because penises are usually how men achieve orgasm, and clitorises are how women achieve orgasm, which is different than the vagina itself. So most people do not orgasm with penetration. If you can, congratulations, you are a ninja unicorn, and we're so happy for you. But that's not the normal, right? It's not the normal. There are people who can orgasm in their sleep. There are people who can orgasm from nipple stimulation. Those people are magical, but they are not what is, quote unquote, kind of the majority. And so arousal is something, listen, in order to have good blood flow to the genitals, whether it's the penis or the clitoris, you need healthy arteries, healthy nerves, and healthy muscles. And we do a lot of things in medicine to screw up with arteries, nerves, and muscles. And so much can affect arousal. But what's so important, and I did a video on this on Instagram recently of that, heart attacks. Everyone was shoveling snow. You can get a heart attack. Well, erectile dysfunction is an early marker for cardiovascular disease. And the same is true for the clitoris. So if you find your arousal is not as good as it used to be, it may be a sign that the arteries are getting clogged. And the arteries to the genitals are tiny. They're these little tiny arteries. And if those are getting clogged, that means the heart arteries, the bigger arteries, may be clogged down the road. And so this is a real important thing, that if you have erectile dysfunction or you notice your arousal has changed, changed, it may be a sign that you may need a cardiologist as well as a sexual medicine doctor to help you. So much can affect arousal and blood flow. So anything that messes up with muscles, arteries, and nerves. So again, many of the things that you saw on the last slide, but pelvic surgeries and diabetes and high blood pressure and cardiovascular disease, opioid use, antidepressant use, smoking, drinking, all the fun stuff. They can really affect the health of the genitals, and then erection becomes difficult. Now, when it comes to the penis, we've got an erection hardness scale that we love to use in our office to really get a sense of talking about erectile dysfunction is a little challenging, and people don't like to talk about their penis. And so we say, okay, a one is there's no erection at all. A 2 is it gets harder and larger, but it will not penetrate whatever you want to penetrate. A 3 gets to penetrate, but it's wobbly. And a 4 is that cucumber, non-bendable erection that everybody wants. And so when we talk about erections in the office, we really are able to use numbers and objective measures to really understand what is going on with you and what therapies might help you. Now, on the female side, arousal is a little bit more difficult to assess, and we tend to think of it as more lubrication, genital engorgement, and it often overlaps with things called the genitourinary syndrome of menopause or problems from lactation or hormone changes. And so it comes not just with arousal problems, but we see it affect urination, and people can get irritation, burning or itching, frequent urination, leakage, urgency, frequency, and urinary tract infections, which can and do kill people. And so if you're having any of these signs and symptoms, that is a real indication that you need help. And a little lubrication is not the answer, although it will help a little. We love lubrication, but we have to actually fix the problem. And we want to fix the problem with vaginal hormones, which are safe for every human on earth and your great grandmother in the nursing home to use. This is what most of my social media is based on. So I'm not going to tell you all the details today, but if you follow us, you'll learn all the details. We have a whole YouTube channel dedicated to this topic. But vaginal hormones are the greatest sex drug in the world. They are Viagra. They increase arousal, they orgasm, and not only are they female Viagra, but they could save Medicare $22 billion a year with the proper use, because people wouldn't go to the hospital with urinary tract infections. If that's not a good story, I don't know what is. Now, for arousal, many of you know about Viagra and Cialis, which we love, but we also have vacuum pumps. We have injections that can give beautiful erections that are very easy and painless to do. There's also the lifestyle changes, the eating right, the exercise. Sleep apnea is a huge problem that can really, really affect erections as well. And we have all sorts of therapies that are being used for experimentation and really lots of options on that side. Now, orgasm. Orgasm's a fascinating one, everybody. So the average man will orgasm in about 5.5 minutes, okay? The average woman, if she's with a partner, actually, if a woman is by herself, she will also orgasm in about 5 minutes. But when she's with a partner, it goes to about 13.5 minutes, and about 20% of you will never take the time to have an orgasm because you don't want to bother your partner and wait around. And we know that more than 18% of women say there's no way only 18% of women say that penetration is how they get to orgasm. So again, you are magical unicorns, and we are so proud of you, but it is not the way most people orgasm. And I always say, we all know there's a pay gap. If we could fix the orgasm gap, we could fix the pay gap. So the orgasm gap is that when we ask people in your last sexual encounter, did you always have an orgasm? 33% of heterosexual women say yes, and 75% of heterosexual men say yes. So there's a big difference between who has the priority to orgasm. Now, treatments for orgasm, my God, do we love devices, because we understand we need our computer to check our email, we need our phones to call people, we use devices to have great orgasms. And for any genitals that you have, there are so many devices out there that can really enhance pleasure, just like there is technology for every part of our lives. And so we'll send lots of information about that. Now, finally, my last 2 slides, because I want to have lots of time for Brooke to talk about the important stuff about how to implement all this stuff, is pain. If you are in pain, it is really challenging to do any of this. And you should not be in pain. You deserve to live a life without pain. And when I see people who deal with pain and we get them to have no pain, it is like it is the greatest feeling in the world, because we've not only helped them, we've helped their families in a larger sense. But pain is complicated, and it is often not, it is never your fault. And we can usually find a reason for it, from hormones to muscles to nerves to back issues, right? We see a lot of spine pathology that can affect the genitals. And so it is so important. You have to understand that the general urologist or the general gynecologist did not get this training often in their school. And so there are resources. We often use pelvic floor physical therapists to help us with pelvic muscles, no matter what genitals you have. And we'll send some resources about how to deal if you do have pain, but really important that you don't suffer. I'm going to hand it over to Brooke. There is a whole Q&A button that you can put questions in, and we will happily answer questions at the end. And I know that is just a small bit of the biology, but I can't tell you how much, if you don't talk about the biology, you're missing the whole story. And the biology can be the pathway to having reasonable discussions about how your bodies have changed. So I hope that was helpful, and there's more to come. Pun is intended.
Okay, thank you, Dr. Rubin. So important. All of these, basic things we need to know about the body, the functioning, the dysfunction, all of that. And then we get into I think the crux of why we're here, which is what to do about enhancing, expanding pleasure, connection, how to create deeper intimacy, better sex, more enjoyable sex, all of that. And so I'm a sex therapist. So I first want to just explain, what is sex therapy? Because some people are a little confused. So sex therapy is really just a form of talk therapy, and it can be for individuals, couples, thruples, anybody is welcome. And we focus primarily on sexual health, sexual function, sexual satisfaction, and any other emotional or mental aspects surrounding sex. Next. Oh, I just realized. Okay. So intimacy. What is intimacy? So I think it's so important to have a working definition, okay? Because people confuse this idea of closeness and intimacy. And what I find when I'm working with couples is one person will say, we're having intimacy issues, and another person will say, we're having problems with, vaginal penetration. And so it's important to understand, what exactly are we talking about? Because intimacy means something very different to other people. First of all, I love to just break down the word intimacy, which is really in, to, me, see. So I believe that intimacy has a lot to do with being seen, being validated, and I think it really is kind of a seeing into the soul. But in general, intimacy is really that deep sense of closeness and connection with another person that usually involves trust and vulnerability and open communication. So it's very difficult to be intimate with someone, where you're intimidated by them or fearful. That really can't exist, because you're not likely to want to be vulnerable with someone where you have those feelings. Next. So let's look at the different types of intimacy, because we are not intimate in exactly the same way with everyone we're in relationship with. So in couples, you can often find sort of four major types of intimacy. There's emotional intimacy, which again, we would sort of talk about as sharing thoughts and feelings and experiences. And really, that is the foundation of deep connection. Now, physical intimacy is certainly what we think of when we think about sex, which involves touch, affection, and also sensual connection, not just sexual connection. And I really believe this gets lost because there's so much focus on sex when actually sensuality, eroticism, it is extremely important if you're working to improve your sexual relationship. We'll talk a little bit more about what that means and how to do that. Then there's, of course, intellectual intimacy, which is, those stimulating conversations, those shared ideas, maybe a little good debate. And here I will often refer to the sort of sapiosexual people who really are incredibly turned on by that intellect, that's really how they're wired, that intellect is what really turns them on. And lastly, there is the experiential intimacy, which is bonding through shared activities and experiences. So perhaps you feel really close to your partner when you're taking a walk with them, you're walking the dog. Perhaps you feel really close to them when you guys are sitting, by a river or a body of water. Now you're going to see on these slides that at the bottom of many of the slides, we're going to suggest an activity. And all of these activities will be in your resource packet, which you're going to receive by the end of the week. So if you don't catch them all, don't worry. We promise we'll have them listed for you. But for example, we want to help people look at whether you're coupled or not, we want you to reflect on these types of things. So that first activity is to journal and or discuss with your partner which of these types of intimacy are most important to you, and then why. Maybe you're going to surprise yourself when you journal about it, that you really thought physical was important, but then when you think about it more, it's actually emotional. And this can generate, all of these activities are meant to both generate fun in the bedroom, but also deeper understanding. Next. So we're talking a lot about pleasure, but what is pleasure? So pleasure is enjoyment, it's gratification, it's satisfaction, but this word I love the most. It's often delight, delight in something that is from some sort of emotional, intellectual, or a sensory experience. And here's what I want to share about what I find in my work. And this actually really saddens me. So when I'm talking about pleasure with, an individual even, what brings you pleasure? Sometimes their sex life isn't going so well and they don't know what, is pleasing to them, what turns them on. They don't actually know. But then when I ask them to reflect on what are some things that give you pleasure that are not related to sex or sexuality, and oftentimes people cannot name one thing that gives them pleasure. So I invite you all to think about not just sexual things that, bring you pleasure, but non-sexual. So for instance, I usually kind of help people start off if they don't know what brings them pleasure. Go outside, feel the sun on your face. How does that feel to you? Or curl up with your favorite blanket and kind of just notice what it feels like to be, in something really soft. Or maybe you feel pleasure when you watch your kids playing. There are all these different kinds of pleasure, and we need to tune into them so that we can also then kind of expand that in the bedroom. Next. So there are sources of pleasure, right? And we sort of talked about some of the ways that there's intimacy, but there's also very similar in terms of the pleasure. So there's physical pleasure, again, touch, intimacy, and then sensory experiences. So that could be running your fingers through your partner's hair, or anything like that. And then there's this emotional pleasure. That's feeling loved and valued and connected to another person. There's the intellectual pleasure, which again, you would just get, turned on and feeling good by the stimulating conversations and actually learning from your partner. That is always really pleasurable and kind of exciting. And then the last thing again is that experiential. So traveling, trying new experiences. A lot of times you might find something like, oh, we always had a good time when we, went bike riding together. But after a while, that may no longer give you as much pleasure. And so this is where we really want to look at creating new and novel experiences, because that is so important. Most of you know a lot about, if you've ever been in any kind of long-term relationship, boredom. Why do we get bored? Because we do the same thing over and over again, and we expect it to have the same effects, but that's just not how it works. If we ate the exact same thing every day, we would get bored. And so sexuality, pleasure, intimacy, it's all very much the same. So here's another activity suggestion, which is to list 3 non-sexual things you find pleasurable, and then seek one of them out this week. Go toward pleasure. Life is hard. We have a lot on our plates. We're busy. The world is difficult and a hard place to live right now. Please find small things that give you pleasure and move toward that. Next. Okay. Pleasure can be hard. I just talked about some things that make it hard to experience. So let's really get into these barriers. What gets in the way of intimacy, of pleasure, of connecting with your partner? So first of all, we do, again, want to just mention trauma. Trauma can wreak havoc on pleasure, on connection, on intimacy, on vulnerability. So I do a lot of work with trauma. And again, we're certainly not going to go into that today, but it is important to always remember that that is a barrier. So a lot of people talk about a barrier being difficulty being vulnerable or letting go. Okay. So people who are tightly wound, who have trouble giving up control, I always say orgasm and anxiety, or orgasm and needing to be in control, have nothing to do with each other. So if you're really anxious, if you're tightly wound, if you want to be in control, there's no way you're going to feel a lot of pleasure, and no way you're going to be able to have an orgasm. So think about ways that you like to control things, and perhaps you could decide that pleasure and intimacy are places that you are not going to do that. You can get up after you have sex and go control whatever you want at work or anything. But in the bedroom, please try to give up some of that control, because that's where pleasure lies. So I talked about the world being a bit of a mess, and current events can certainly make people not feel sexy. If they're constantly inundating themselves with news, then the idea of relaxing and being intimate might just not appeal to you. Shame can be a big barrier to pleasure. Shame also plays a big role in masturbation. Many of us were taught growing up, whether through religious, structure, or our family structure, that pleasure and masturbation was actually wrong and you'd go to hell, or just kind of frowned upon. And so shame really shows up in masturbation, and it often gets very linked to sex and sexuality. Anger and resentment. Man, do I hear a lot about this, especially with couples who've been together a long time, where one partner might be just carrying around a ton of anger about anything in the relationship, the in-laws, the workload, the mental load, division of labor, anything. And that anger and resentment is really going to get in the way of wanting to show love in any sort of physical way to your partner. The kids, we all know about that. We don't even need to talk about that. Kids get in the way. They're always around. I would suggest getting a white noise machine and putting it, the one therapist used, putting it right outside your door. It really helps. as Dr. Rubin said, please have a lock on your door. That way you're not anxious when you want to be intimate with your partner, when you want to fool around. You know they're not coming in. We are inundated, and we have so much more mental health issues in, the last 20 years, specifically, I think, since COVID. So there's a lot of anxiety and depression. It's very hard to be able to even experience pleasure in your body if you are anxious or depressed. And so someone who's struggling with depression, asking them to invest in their pleasure in their sex life is very difficult, almost impossible for them to think about. Fatigue, we're all too tired. That is the number one complaint I hear. And that's why, again, we want to kind of reiterate that idea of perhaps moving your fooling around, your sexy time together to the morning when you actually have more energy, when you literally have the hormones to support a fun time. And a lot of people will say, no, I have to get up. I have to rush to work. Set your alarm for 15, 20 minutes earlier. I promise it will help. And it really sets the day off to a great start. And it immediately allows you to feel close to your partner at the beginning of the day. Disconnection and dissociation. A lot of people feel very disconnected from their bodies. They don't feel present in their bodies. And certainly a big trauma response is dissociation. So if something traumatic happened to you, you kind of feel like a little bit distant from your own body. And pleasure requires presence. Pleasure requires being mindful and totally in your body. And so those are barriers. Multitasking. If you're trying to do 5 things at once, you do not have space to think about sex, think about doing anything that will deepen closeness or connection when you're doing 5 million different things. So stop multitasking. And we really now learned that it isn't really possible, actually, to do that well. Busyness. We're always busy. We've constantly got that narrative, busy, busy, busy. I try to say something different if someone asks how I am, and I say, I'm feeling full. My life is feeling full. It's just a reframe, but you might want to try it. And then, of course, chronic pain, chronic illness. There are so many people struggling with chronic pain and chronic illness, and that can also be a really big physical barrier. Next. So let's talk about the destination of pleasure, which is very different than the destination being orgasm. So why is it important to shift away from orgasm and move toward pleasure? And why aren't we sort of doing that? Well, first of all, we're very results oriented, right? Something should have a beginning, a middle, and an end. And for most couples and heterosexual couples, we somehow have decided that sex ends with a man ejaculating. And so that's crazy. What about the woman? Did she have an orgasm? What about the partner? And so we want to really move away from that sort of idea that sex stops with some sort of ejaculation. One partner could orgasm and you could completely keep going until the other one does. So let's move away from that. So again, why? Why do we want to talk about pleasure and not orgasm? Well, first of all, if you are hell-bent on you and your partner having an orgasm, or even while you're masturbating, if that is the sole goal of, your self-pleasure, then you are putting so much pressure on yourself and your partner. So it totally creates this performance anxiety. And when you're worried about how you're performing, it's going to reduce pleasure, like hands down, no matter what. So also, when we think about better emotional and physical connection, when couples slow down, when they focus on each other and focus on pleasure, then they're much more likely to focus on that sensuality, that eroticism that is so necessary for good sexual connection. And they're much more likely to be focused on foreplay And remember that as you age, foreplay becomes even more and more important. It takes a while to get going. It takes time. So to slow things down, focus on foreplay and deepening that connection. The other thing that really helps is you're going to have more freedom for that experimentation. So when orgasm is the goal, couples fall into repetitive patterns. And again, masturbation, if you're doing it the exact same way, because you've decided, well, I know this grip at this angle works best with this, porn beforehand, you are likely to just keep doing it that way, okay? Which is boring. And also, you just get into these patterns. So I want to come, he wants to come, he has to go on top, we have to be done, then I have to grab my vibrator and do it this way. So again, you want to shift your focus and allow for trying new things, trying new positions, new angles, new toys, so that you're exploring those new sensations and the techniques. You don't only want kind of one move, Um, I also find that this really helps having less disappointment and more enjoyment, okay? So since people don't orgasm every time, that is not something that is sustainable for your entire lifespan, that you're going to orgasm every time you have a sexual encounter with yourself or with someone else. If you take the pressure off, then you're going to decrease those feelings of frustration. And oftentimes when you're partnered, that can really, really bring up feelings of inadequacy if you didn't have an orgasm or you don't make your partner orgasm. And by the way, this is a hint, you are responsible for your own orgasm. Don't wait around for your partner to figure it out how they're going to make you have an orgasm. You're in charge, and you need to communicate how that's going to happen. The other thing is, if you are only focused on orgasm, as I said, if you get there quickly, then that's kind of it. And so we do find that people are having longer and more satisfying intimacy by slowing things down and focusing on pleasure. And here is the other extremely important thing that I want everyone to hear tonight. Sex is more than vaginal penetration or anal penetration. Sex is anything you want it to be. So sex could mean hand holding, sex could be oral sex could be anything you want. So as you age, expand your definition of sex, because as things become more difficult, as erections, are not as strong as you age, if your only definition of sex is a penis in something, penetrating something, then you're going to be very disappointed. So please think about how you can expand your definition of sex and make it a lot broader so that you can really feel like, yeah, I can have sex the rest of my life. Next. Not all touch is created equal. So what I hear a lot of is about how people don't always love when their partner only approaches them with sexual touch, okay? And that's touch that is really, kind of geared toward intercourse, okay? That is touch that is all about, let's move toward intercourse as quickly as we can. And a lot of people do not like that. So we want to explore these different types of touch. So first of all, affectionate touch, which a lot of people really love, and it gets overlooked sometimes. And men and women like this. I think sometimes people think that women are the ones who really want the holding hands and the hugging. That is completely not true. And I hear this all the time with couples in heterosexual relationships. Men crave this affection. And sometimes they actually want that more than even sex. So again, holding hands, hugging, kissing. And this provides that foundation for intimate attachment, okay? And this is where I want to remind people that getting back to basics can be incredibly fun and empowering. So instead of, again, this affectionate hand holding is going to lead to sensual touch, erotic touch, and then intercourse type touch, why not kind of decide, hey, do you want to just make out and just make out and that's it? That gets us back to our younger time in our lives, which was very exciting. I'm sure you all remember that there were times that simply kissing your partner could go on for hours and you got a tremendous amount of pleasure from that. Go back to basics. Set some ground rules. We're not going to take off clothes today. We're not going to end up having intercourse. Let's take it off the table and simply enjoy the very pleasure of kissing or holding or cuddling. Now, there is a sensual touch, which often is non-genital in nature, but kind of has a little more flavor to it. So this might be a foot massage or a back massage, something that can kind of make it a little more exciting and a little more erotic. Now, a lot of people have different feelings about playful touch, okay? So this could be, you touch your partner when you're coming out of the shower, or there might be, you're doing dishes and your partner comes up and gives you a little swat on the tush. Now, some people love this and they do find it playful and fun, but you need to ask your partner how they experience it. I do hear from couples that, they don't want their breast grabbed when they're feeding the dog, that doesn't feel good to them. And so please make sure that the type of touch you're giving your partner is actually wanted. Because I do hear that people sometimes kind of cringe when that happens and it doesn't feel good to them. So ask your partner, when I do this, do you like that or is that annoying? Then there's erotic touch, again, which is not necessarily intercourse touch, but it could involve your genitals, it could involve oral sex, any type of sexual play. And then, of course, intercourse touch, which we understand. So this is really important. I want everyone to sort of listen. I find that many partners are very likely to cringe, pull away from touch, not because they don't actually want to be touched, but because in their experience, that means that their partner wants sex. So a kiss is not just a kiss. A hug is not just a hug, right? A cigar is not just a cigar. It actually is meant to initiate intercourse. Well, that actually limits pleasure and it limits your partner being really, enthusiastically responsive. So if I know that when you start giving me a back rub, that what you're really saying is you want intercourse and you want it, soon, then when you start to touch, I am gonna feel very shy of that. And you're gonna feel rejected, right? So if if you initiate that kind of touch and I reject you, that's going to feel really bad. So you want to talk about that maybe your partner really wants to be touched and just for the sake of being touched, and that they want to be reassured that this means it can end with that. I promise you, they are going to respond and reciprocate so much more if they know that the goal is not always going to be intercourse. I promise this works, but you gotta talk about it. Next. Okay, let's talk about sex and connection and the complete paradox. I know many of you know about this. So a very common dynamic in couples is that one partner will say, I need sex in order to feel close to you. Okay. So that sex has to come before connection and closeness. Well, usually the other partner is very confused by this because they feel very oppositely. The other partner tends to feel that in order, they need to feel emotional closeness in order to have sex. So that without that emotional closeness, there is no way they're going to want to have sex. Okay. First of all, one is not better than the other. So a lot of women feel that the emotional closeness is much more important, and then they're likely to perhaps want to have sex or initiate some sort of sexual play. That is not better, folks. One is not right and one is not wrong. It is simply the paradox of what it means to be coupled with another person. And so I encourage you to talk about that and then try to figure out ways to meet a little bit more in the middle. So we have an activity, which would be to plan some non-sexual intimacy that, again, does not lead to sex right away, so that you're trying to meet a little bit more in the middle. Next. So desire and arousal are very confusing to people, and people usually use them interchangeably, which I think makes it really difficult to kind of figure out. So which comes first? So desire, which is the same thing as libido, is the mental and emotional state of actually wanting to be sexual, whereas arousal is of the physiological changes that happen when you're sexually excited. So lubrication or, blood flow to the penis, okay? And again, there is no correct order. But here's what I want you to know that is most important. You should not be sitting around waiting for lightning to strike, which will automatically make you feel desire, and then you're ready to initiate some sort of sexual connection. Stop waiting around. It may not work that way for you. So, what you want to understand is that some people experience desire first, but a lot of people may need to get started and become physically aroused. And then that arousal sends the message to the brain that there's desire. Okay, so it's really important that you understand that. Do not wait around. It will not necessarily happen for you. So that whole idea of I'm just not in the mood, I sort of say too bad, because sometimes if you want to be sexual, I'm not saying if you don't want to, but if you wish you felt desire, why don't you just try for a few minutes? So that idea of, I don't know, let's try and see what happens. That's a wonderful attitude. That willingness to try will take you far. Okay, next slide. Desire versus pleasure. Okay, so we know what desire is. It's that motivation, that longing for the connection. And then pleasure is what we actually experience, right? So again, that same thing is you do not have to have desire before pleasure. So sometimes I will tell someone, if they have a date planned for sex, that they can take the matters in their own hand and they can go masturbate in the bathroom for a few minutes before their partner even comes home, so that you can initiate pleasure. And then again, it is almost always that the desire follows. This is why people say things like, well, once I get started, I enjoy it. That's this idea. Please don't wait around for desire to just, pop out of the sky. Again, another activity you could do. Next, let's quickly talk about responsive versus spontaneous desire. We all know what spontaneous desire is. It's getting horny in the middle of the day for no reason, like you did when you were 18 and 20. Well, the responsive desire is that you will actually respond to some sort of sexual stimuli, okay? So maybe you watch a sexy movie or you smell a great cologne. And so a lot of people think that one is better than the other. So next. And here's what I want you to know. Spontaneous desire is great. It's a lot of fun, but it does change over time, especially when you've been with someone for a long time. Responsive desire is more important than spontaneous desire. And studies actually show that couples with the most enduring connections, they focus on intimacy. They plan it out. They are not just waiting and relying on that initial spark they felt when they were 24 when they first met, okay? It is much more common in long-term relationships. And that's what you really want. You don't necessarily want to just feel horny in the middle of the day for no reason. What you want is to strengthen that responsive desire. Okay. And the responsive desire can encourage deeper intimacy. It reduces that pressure, that expectation to always feel in the mood. You are not supposed to always feel in the mood at the drop of a hat. So you want to be able to respond, and it is much more sustainable over time. Next. Schedule sex, schedule sex, schedule sex. A lot of you are rolling your eyes and groaning, but you know what? You schedule a lot of things that are important to you. You schedule doctor's appointments, you schedule the personal trainer, you even schedule when to take, an antibiotic. So if it matters to you, schedule it. It creates anticipation. And I promise that when you kind of have that anticipation and you have that time set aside, you can kind of do something to relax into it, and it usually goes a lot better. Next. Okay, let's talk about brakes and accelerators. And again, this is all from Emily Nagoski's work. She has a wonderful book called Come As You Are. I would strongly recommend it. So what are sexual brakes? Those are turnoffs, basically. Any factors that inhibit your desire. Could be stress, a relationship conflict, that t-shirt that your partner wears all the time that has holes that you secretly want to just put in the trash. Granny panties might be a break for some of you. Bad breath is certainly a break. And then cologne goes either way. So I've actually included it in both a break and an accelerator. There are some people who hate cologne and it's a break. And then there are other people who love it. So as you can imagine, it's just what it sounds like. What is a sexual accelerator? Those are your turn ons, okay? Any factor that enhances your desire. Emotional closeness, sexy underwear, fresh breath, of course. And again, cologne could go either way. Openly communicating about your own brakes and accelerators takes the guesswork out of initiating sex. So again, if you think that you're going to turn your partner on by grabbing their tush and that's a turn off, then you're hurting yourself and you don't even know. So your activity is to reflect on your sexual accelerators and then maybe guess some of your partner's sexual breaks and then talk about it. Next. I cannot stress enough the importance of mindfulness. We're all sick of hearing about how important it is to meditate and be mindful, but it really matters. And during sex and any type of sexual play, being present enhances that pleasure and connection. Again, if you're distracted, if you're ADHD and your mind is elsewhere and you're not in your body and actually experiencing these sensations in your body, you are not likely to feel desire or pleasure, anything like that, okay? Put down your phone. Focus on your partner without distractions. Do not be doing 6 things at once, okay? Savor the moments without rushing. Sometimes I just encourage people to do like a 2-minute meditation together before they're gonna fool around or be together in any sexual way. That really sets the stage of both of you coming into your bodies. Pleasure is all about feeling your body in the moment. And what is mindfulness? It is noticing what is in this moment. And the easiest way to do that is just check in with your 5 senses. What am I seeing? What am I hearing? What am I smelling? What am I tasting right now in this moment? So again, Here is a very difficult activity, eye gazing. Eye gazing is a wonderful activity to promote closeness and intimacy, and it really gets you in your body. It's much more difficult than you think. Start with 2 minutes, notice feelings, notice sensations that come up. We're almost done here. Okay, next. Masturbation. Why in the world does every sex therapist recommend it? Masturbation increases self-awareness. Again, you cannot tell anyone the way you like to be touched if you don't know yourself. It improves sexual confidence. If you know what turns you on, you are going to go into sexual activities with a lot of confidence, and it really reduces anxiety to know how your body works. So masturbation enhances sexual stamina and control, specifically for men. Regular masturbation really works on arousal control and can absolutely help with premature ejaculation. Please remember that the vice grip you use for masturbation is not necessarily the same as, what a vagina might feel like or an anus might feel like. So you may want to change up your methods because that vice grip, it may not relate. Masturbation also decreases sexual shame, getting used to your body, knowing what you like, and we really want to get rid of those negative beliefs. Masturbation reduces performance pressure because you can just enjoy masturbation and you don't always need to have partnered sex and put pressure on your partner if you can masturbate. And it also promotes sexual health. Okay, we know it increases blood flow, reduces stress, and as I said before, that amazing sleep aid, great for insomnia. Again, remember that sexual toys and devices are amazingly pleasurable sexual experiences with yourself. You do not need to be threatened by sexual devices or vibrators. They are simply a tool. So try using a new toy, use a different grip or method next time. Next. Okay, so non-sexual intimacy. This is where we're talking about beyond the bedroom. We talked about the importance of shared activities. It also, again, you want to try something new. Novelty is important. Pickleball, go try pickleball together. Take a cooking class together, because sharing those things really increases closeness, especially when it's something new, because it's not boring. You're both giving it a go. So again, that non-sexual intimacy, that eye-gazing activity I mentioned, stimulating conversation, using a card game to begin to talk about your relationship or intimacy. In the resources, we give you a lot of links to some fun card games, intimacy card decks that can really promote that closeness and intimacy through conversation. Why not read a book together or watch a documentary and discuss it? Again, those intimacy card games and laughter and humor. I do want to remind people, humor can be a really wonderful part of a sexual relationship. Don't take it too seriously. There are a lot of crazy things that happen during sex, sounds, noises. Laugh it off. You got to have a sense of humor. Okay, next. So here are some tips about communication, okay? You always want to create a safe and comfortable environment. Do not talk about your sexual relationship right before or right after a sexual experience. Have it be a neutral place. Invite your partner to talk about it. Don't talk about it when there's already a huge problem. Talk about it at another time where maybe you have some ideas about how to improve things, but some things are going well. Always use positive and encouraging language. Express appreciation. Focus on what you do enjoy first, okay? Express your desires and boundaries very clearly. Be honest about what you want and make sure you respect your partner's limits and your own. So don't say you want to do something if you don't want to do it. Be open to exploration and growth. So approach the conversation with curiosity, not judgment, and a willingness to evolve together. And revisit these conversations regularly, okay? Make it ongoing dialogue. You know, people always talk about the sex talk with your kids. That should be a series of age-appropriate conversations over their entire childhood into adulthood. Same thing here. Revisit the conversation so it's less awkward. Now, here's what not to do. Please do not tell your partner you've been faking it for 30 years. Do not tell your partner that actually you've always hated the way they kiss or hug or touch. Don't do that. Not helpful whatsoever, okay? Avoid blame, shame, and criticism. Please use I statements because that's all you're talking about, your own experience. Don't use you statements to express your own needs. Avoid dismissiveness, validate your partner's feelings and experiences, even if they're just different than yours. Don't rush this conversation. Give space for thoughtful dialogue when you have a lot of time. Don't do it, you know, in your 5 minutes in the car, in between errands. And here's another important thing. Please do not compare or talk about past lovers or experiences. You, of course, can talk about previous sexual experiences with this partner, but this is a unique relationship and connection, and it will go very poorly if you begin talking about, you know, previous boyfriends, girlfriends, partners. So some of you who are parents will know this idea of don't yuck your partner's yum. Okay, so if a partner is brave enough to share that actually they've always been interested in having sex in public, and that's something they've been afraid to tell you, please don't react with shock or repulsion. You do not have to want to do it to just simply say thank you for sharing that with me. Next. Okay, here's some things you might need to just get over, okay? Get over the fact you are not 18 anymore. Your vulva is different. Your erections are different. So things are changing. You need to get over the fact that it is not bossy to tell your partner how you want to be touched sexually. They cannot and are not responsible for reading your mind. So you have to say a little to the right, a little to the left, harder, softer. That is not their job to know because every person is different. I said this many times before, but I'll stress it again. Stop waiting around to get in the mood. Focus on cultivating that willingness to try, since arousal can lead to desire. Vibrators and sex toys are great tools like lube and lingerie. There is no value judgment on a vibrator or a sex toy. You do not need to feel threatened by them. And you can't tell someone what you like if you don't know your own body. So you have to get over the fact that masturbation is wonderful and helps. Okay, just a couple more. Next, 10 takeaways. It's normal to struggle with connection and intimacy in long-term relationships. It's normal to lose some of the spark that you felt at the beginning of a relationship. Nothing is wrong with you. We always want to rule out medical issues related to libido, arousal, orgasm, and pain. Please expand your definition of sex. You are responsible for your own orgasm and pleasure. So you got to stop faking it and tell the person what you want and need. Communicate your needs, desires, and fantasies. Fantasies are not always things that you want to do behaviorally, but they're things that just turn you on. Masturbate, masturbate, masturbate. Schedule sex and practice mindfulness and connection in and out of the bedroom. And when discussing sex, always start with the positives and use I statements. So those are the big takeaways. I want to reiterate that you are going to get these amazing resources. We've got devices listed. We've got erotica apps, meditation apps, links to games, communication prompts, other prompts that can really help facilitate ongoing discussion about sex and your sexual relationship. We've got a week of sensate focus, which are things to do to get back to basics around how you like to be touched. So there's so many wonderful tools that you are now going to have. And that's
This is so fabulous. And I can't tell you how difficult it is to do all of these things, how challenging it is for everyone. Otherwise, neither of us would have a job if this were easy. And I think it's the implementation. It's the dipping a toe. It's I know I shouldn't eat sugar, but it tastes, I know I should exercise every day, but I don't. Why is this so challenging? And how can we dip a toe? How can we get started? I think the first, like again, how do we just start that conversation?
Yeah, I mean, I think it's honestly, hopefully you can share this first of all with your partner if you have one. Um, but hey, I've noticed something we don't talk about much. We don't ever talk about our sexual relationship. What do you think about that? Would you like to do that sometime? Really, just showing up with kind of saying what is and also curiosity. You know, there's something I've been wanting to ask you about, and I've been a little bit afraid. I always tell people, please own your anxiety ahead of time. If you say to your partner, I am incredibly anxious. I'm so worried about this conversation, but I want to talk about sex. The odds of your partner getting angry about that are pretty small because you just said, I'm vulnerable, I'm scared. So own your anxiety, own your vulnerability. It will really help your partner feel really open to it. And again, not right after there's been some sexual mishap or something. Do not do it then.
All right, friends, this is so fun. We're just starting now the next step of this. So I would ask of all of you, if you want to enter our raffle to get a lovely device that's been donated by an incredible device company called Elixir Play. Now, Elixir Play is based in Australia, and they really understand pain with sex. They really understand bodies that have pain, and they are also for bodies without pain. But I just love the quality of their devices and the thought process about the biology that goes with it. So, if in order to get this device, you have to fill out a survey about something that you learned tonight, about something that you enjoyed. So while I keep that QR code up for the brave souls that are going to fill out our survey, we're going to do a couple more polls. So let's see what we've got here. All right, so we're going to do the next poll. We're going to launch it. What barriers do you want to tackle? Do you want to, deal with fatigue? Like, what barriers do you have? Are you always dealing with fatigue, kids and family, current events? Hopefully, you can all put all of the above. Anger, resentment. Can you only choose one? I don't know. I don't know what we put there, but what are the barriers that we all need to focus on and say, you know what? My pleasure matters. I should actually take a minute for me. All right, let's see. We've got I'll give 2 more seconds for you to respond. I know you're trying to do the survey and respond at the same time. This is the multitasking that Brooke said we shouldn't do, but here we are. I'm going to give it 2 more seconds. All right, let's show the results. You guys are all a mess. We're tired. Our kids are always around. Current events, only 5%. I'm impressed. Letting go is really hard. Anger and resentment. It's really, how do you, getting over those things? There's a lot of others, and we got all of the above. 23% got all of the above there. So this is something everybody is dealing with, right? All right, let's see what's next. What do you want to tackle first? What are the major issues that are holding you back? Now, it's hard if there's two people in the room watching this, but maybe, do you want to focus on your libido? Is it your arousal, your orgasm? Are you having pain? Where do we need to focus? What are you all bothered by? People are responding. This is fabulous. We got a great group tonight. You all invested in yourselves to say this matters to me. You've showed up. You're still here. It's incredible. You have to understand that most people don't do this. Most people don't show up to this on a Wednesday night to say, you know what, Valentine's Day, we're going to do it differently this year. And I just can't wait for you and your partner or partners or yourself to have a really good time. So we are not surprised by this, right? So 52% of you said libido, libido, libido. It all starts with that desire. The data supports everything that we see here. 24% of you have arousal concerns, 15% orgasm concerns, and about 10% are dealing with painful sex. Pain should never be what's happening. There is so much we can do for actually all four of these things. We have tools in our toolbox, and it is a growing tool. And if your doctor is not helping you with that, then you need to expand the toolbox to include people who genuinely care about these issues. Because if you showed up to this webinar, you care about this stuff, right? Like this isn't something if you don't want sex, or no one ever died because they didn't have an orgasm, by the way. It's never happened. Like, I don't know if your partner needs to hear this, but nobody ever died from not having an orgasm. It's never been reported. So the question is, are you here because you want to be here, because you want to have more fun, because you want more joy, more pleasure? All right, my next question. Are you worthy of pleasure? Are you? Like, do you, it seems like a simple question, and I can't tell you how many of you are hesitating right now, and you're like, I want to feel worthy of pleasure. I feel like I should be worthy. But like, do you treat yourself like you are someone who deserves pleasure? And that's a hard question sometimes. Well, we got a lot of answers on that one. Most of you decided to choose pleasure, and I'm proud of you, right? You're here, you're choosing pleasure, which is so beautiful. So beautiful. Okay, I think we've got, oh, I like this one. Do you or will you start to schedule sex? I can't agree with Brooke more on this one. If it's a priority to your life, it is on your calendar. This is why I don't exercise enough. It is not on my calendar, and I fit it in where I can. If you schedule sex, you will. I have a lot of patients now start doing, we do quarterly spouse days where you block off 4 days a year, 4 Fridays a year. You plan to, your partner plans to, and they're not like sex days, but they are intentional days that you have blocked from your calendar to say, you matter to me. And I can't tell you how many of our patients are having such a great time with quarterly spouse days to say, I can take 4 Fridays off a year and not die from work. And the quarter goes by quickly. So that's another fun thing. All right, 23% of you are never scheduling sex. So right now, we're going to improve your sex life. We got to get better at that, okay? So sometimes only 17% of you always schedule sex. So A+ for you guys. It doesn't have to be every time. You don't have to always do it. All right. What activity do you want to try first? Journal and discuss with your partner. Non-sexual things you find pleasurable. Identify and name the barriers of intimacy. Oh, this is a long one. Okay. Plan some non-sexual intimacy. Schedule sex. Yeah. So what are you all gonna, you can scroll through. What are you gonna work on? Are you gonna set it, the gazing into each other's eyes for 2 minutes? I would never be able to do that. I'm just gonna put it out there. Like there's just no chance.
It is very challenging and actually very meaningful, but I certainly understand. You could try 10 seconds. And sometimes it also just leads to silliness and laughter, and that's awesome.
I will say, so we see lots of people. I take care of such a large age range. And the couples who are having fun sex in their 80s and 90s, and I have a lot of couples that are still having great sex in their 80s and 90s, they are the most playful couples. They're laughing, they're touching, they're just joking around, they're enjoying each other. It is like the most beautiful thing in the world to watch. And it is what I've noticed over and over and over again. The couples who stay intimate like have this just playfulness and childlike wonder about them, which I love watching that. All right, so let's see, little bit of everything. All right, everyone's gonna try something new. I love that.
I love that the majority want to list some non-sexual things that you find pleasurable and seek one of them out that this week. I think that's amazing because that really gets at just this kind of baseline of what do I like? And
It's a hard one these days. Like, what brings you joy? Like, and if you can't find that, if you have no space for your own joy, why are you going to have space to help with someone else's joy, right? It's so challenging. Oh, I love this poll. These were fun. Okay, so hopefully for anyone who's had the chance to check out the survey for tonight, we can't get better at this unless you tell us how to get better at this. And one random person will be chosen for the device giveaway. So now we're going to jump into some Q&A. Please follow us on social media. We are constantly yelling and screaming about all of these things. I can't tell you how much we are just so passionate about doing this. We have no agenda other than to say this matters. And it is so important that we try to improve education and communication around our bodies and sex. And we can just all be a little happier, a little bit more, you know, a little happier. All right. So let me stop sharing my screen here and we're going to go to Q&A. All right. Let's see what we got here. It's no doubt that vibrators help orgasm happen, but is it a less satisfying orgasm? Everyone asks, can you become dependent on your vibrator?
Would you like me to answer
Yeah,
that?
you go first.
Okay, I think the answer is no. But I also think the answer is, that variety helps, right? And so if there's only one vibrator and you can only do it one way, then certainly it is more likely that other ways of, touching yourself or having someone touch you, like fingers or anything like that, it might take longer. And so what I usually just tell people is go enjoy what makes you have an orgasm. That's what you should be doing. But every once in a while, kind of mix in, throw something else in for a little variety. So you can also kind of experiment different types of sensations and kind of factor that in to
I
play.
agree. And I love variety. And again, too much of anything is never a good thing. If you can, I see so many people who say, well, I can only orgasm when I masturbate in this position with this device, watching this porn. And now I can't have sex with a partner. I was like, well, yeah, because it's like Pavlovian. So you got to try different things, right? So it's not necessarily the porn's fault that you can't have sex with a person. It's the idea that you are just so regimented in how. So try going in the shower, try laying down, try using your brain, try reading, right? Like try different things. And again, if you can never orgasm without a vibrator, then use a vibrator, right? Like this is like this idea that you're now withholding pleasure from yourself because it should be more natural that your partner should do it. I can't see without my glasses or contact lenses. I just can't. No matter how much I will myself to do those things and do meditation and breathing, it's never going to happen, right? So sometimes you got to use technology to help you. Okay, I think my partner is too big for me, even with lubrication. What can I do about this? So there's actually a great new term that I heard someone say called genital mismatch. So it's not that my partner's too big and I'm too small or vice versa. It's that our genitals are just not matching up so well. Maybe I have pain, maybe there's bad lubrication, maybe the erections aren't so good. So when you're dealing with genital mismatch, it really becomes an understanding of what is the problem, what's the biology behind it. Is it truly that the partner is too big or your pelvic floor must, because babies can fit through the vaginal canal. Let's get real. Like these are watermelons that can fit through there, and none of your partners like watermelon size. And so you have to understand that the vagina and the pelvic floor muscles are able to be more elastic. That being said, lack of hormones, tightness that can happen for many different reasons. The not, everyone talks about tight is the right answer. No, no, no. Sometimes it's like too much, right? You want to do the reverse Kegel to relax the pelvic floor. So you actually can learn how to get genital matching to happen, but this is where you really do want to see a doctor to diagnose the problem. There are also things like dilators that can be used to help stretch open the vaginal canal. I like physical therapists teaching you how to use those. Do constriction rings, we've gotten quite a few questions about constriction rings. How do you counsel, I have my opinions, but how do you counsel people on these constriction rings around the erection? Do they limit the ability to orgasm? Are they helpful? Are they hurt? Do they hurt? What do you think?
I think everyone has a different experience. I have not come across many people who've had trouble ejaculating with them. And I think they often just make everything much more pleasurable. So I'm a fan if it works for you. I mean, whatever works. We just want people trying new things. What do you think?
Yeah, the thing about constriction rings or cock rings, as a lot of people call them, it is not a one size fits all. And I always say it's kind of like MacGyver. You got to find the right one for you and your body. There's ones that vibrate. There's ones that go around your scrotum. There's ones that are flexible and stretchy. They even make, there's a company called Firm Tech that makes one that's like a Fitbit for your penis. It will monitor your erections. They call it erectile fitness. It's a fascinating piece of technology. There's more and more technology out there about rings. Now, if it's so tight that it squeezes the urethra closed, not only might it hurt, but that could restrict your ejaculate that comes out. It shouldn't restrict your org. So here's a fun fact that I didn't say. Erections, orgasm, and ejaculate are three separate things. So you can have an erection and no orgasm. You can orgasm without the goo, the ejaculate coming out, and you can orgasm without the erection. Like all of it can happen without each other. They're all different biology. So we have a question in the chat box. My partner has difficulty orgasming, but his erection is fine. And so the answer is it's not you. You're not doing anything wrong. My guess, the question you would ask for him is this also a problem with masturbation? And I would suspect that your partner probably has some back issues, maybe some sciatica, maybe he jumped out of airplanes and had a laminectomy or something like that. We can see all sorts of, or he had a pelvic surgery that can affect the nerves to orgasm, but it's not affecting the nerves to the erection. So this is a very biological thing, and there are things we can do to help. It's a tricky one. It's not the easiest thing to solve, where we have more tools for erections, but I can't tell you how many people come feeling that they are to blame, that my partner can't do this thing. It must be because I'm not attractive. It must be because they're cheating on me. And there's all biology. There are always the biological answers. How do you explain to couples that it's not them, it's the biology?
First of all, I always start with your sexuality is yours. You are a sexual human being without anyone else, right? You can be if you choose. And so it often has nothing to do with the other person because you've got your own stuff going on inside your own body. So it's, as you said, it's almost never because someone's doing something wrong. And I think, in some ways, we're very narcissistic. We want to think we can fix it. So we want to think we might also potentially be the problem. But actually, your body is your body. You get the body you get. And obviously, people see you to work on whatever they can work on. But the other thing is, I was just thinking about what you said about the person who doesn't ejaculate. Also, is that a problem for the person? Or is it a problem for you? Like, I don't make him ejaculate, but if you talk to him, he might say it's the most pleasurable thing I've ever had. I don't really care about ejaculation. So also make sure that you're not sort of projecting your own thing on someone. Sometimes people just don't necessarily care. Now, for some people, it might be painful not to ejaculate. I don't know.
I love all of that, and this idea of believe them. When your partner tells you that you are enough, believe them. When your partner tells you they find you sexy, believe them. When your partner says that they want to give you oral sex with no time limit, let them. When your partner says, I'm here just for you to have pleasure, believe them. Like this idea that we put our own stuff on them and think, well, they don't really mean it. Well, they don't really want that from me. Well, I feel embarrassed. I feel there is this ability of like, life is too complicated. Just believe them, right? Just believe them. This is a fabulous question. This is someone actually who owns a device store that is asking this question, and that makes me want them to donate more devices for this giveaway. But I love this question because people are often told that communication is the answer, but what we don't talk about is the skills of receiving communication. And do you have any tips? So if you're someone who says, okay, I'm going to bring this up, how do you receive that as a partner, not become defensive, not be like, kind of, no one comes with a manual. And so not only do you not have a manual of how to start the conversation, but you don't have a manual of how to receive the information and how to support your partner. I love that question.
A great question. And I always start with the very simple, thank you for sharing that. And guess what? sometimes that might be all you can do because you are being flooded and you are starting to feel defensive, or you are feeling scared, or like there's something wrong. And simply saying, thank you for sharing. I heard you. And then what I really like is, the practice of mirroring, right? So mirroring is simply just saying back to your partner what you heard them say. And a good communication can be as simple as someone saying something, the other person mirroring that back, and that the person says, yeah, that's what I said. And that sometimes can just be enough. But certainly, again, you want to really think about how brave and courageous your partner was for probably bringing something up that was very difficult for them. So even little things like, having an open stance, right? Not, entering a conversation like this and trying to even open your body, that can actually change how you receive something. You tend to be more open, and realizing that it took courage and that you don't want to shut your partner down. You actually want them to know that it's safe to share even more, because that's better for your relationship. And so you can also say, I'm noticing that I'm feeling defensive. I don't want to do that. And so that might be enough right now. That might be all I can do today. And that is much better than going off, being defensive, turning the tables around on them, saying, well, you don't do this and you do. So just stay with what they did. And if that's a lot, that's okay. You can just say enough for
And
today.
don't be afraid to get a third party involved. And I don't mean that like a threesome, although if you're into that, that's on you. And if it's consensual, it's fine. But Serena Williams has like 10 tennis coaches, and it's not because she's bad at tennis. She's amazing at tennis, right? Like how many coaches were in the NFL Super Bowl, right? There's so many coaches, because when you're good at something, can you get better at it? And so when you approach your partner of like, I think we're really good at sex, but I have a really hard time about talking to you about this, that, and the other, because I have a hard time of just saying these words out loud. Bring someone else in to help guide you, to help walk you through it, because you're really good at your job. You're really good at what you do for a living. You stink at this. Like both of you stink at this. All of you stink at this, right? Because you don't have the language. You don't have the tools. Most of you don't even know what your body parts are called. So how are you going to ask the questions and know what to do? So this is where having a sex therapist guide you. And it's not there. I wish it was like, it shouldn't be sex therapy. Like you need a therapist, you're broken. It's like you need someone to help you to like live your best sex life. Okay, so I love this question because someone was listening to me and says, my penis is a 3. What can I get to get to a 4? So remember, we said 4 numbers for a penis. 1 is no erection at all. 2 is a little harder and larger, but not going to penetrate. A 3 will get in, but it is wobbly. And a 4 is that cucumber style erection that doesn't bend or buckle. And so there are many tools in our toolbox. It really depends on your story, your history. So again, it may be lifestyle, sleeping enough and exercising is really good. There's some data on Mediterranean diet. But for a lot of people, you want, again, checking that testosterone level because that's important for muscle. Using pills like Viagra, Cialis, Levitra, which relax the muscles of the penis that get a lot of people to a 4. Using those constriction bands. We put injections into the penis. That's how porn stars keep their erections for so long. We teach our patients how to do that. And then there are surgical options that are beyond the purpose of this webinar, but there are so many tools that we have for erection health. Someone else asking, I'm 68 and I've never had an orgasm. Is it really possible to learn at my age? I'm trying to be realistic. What would you say to her?
I would say it is possible, for sure. But I would also say that, again, that focus might really need to shift to pleasure, more than orgasm. But of course, everybody wants to know what the big deal is, right? And so, you should keep trying for as long as you want. And this is where I would recommend some of the things and the resources. There are some online programs that I really recommend. OMG, yes. There are a few more that will actually teach you. Betty Dodson's work is tremendous. The rock and roll method for orgasm, so that they will literally show you with real people, this is not pornography, techniques, very, very specific techniques that will help most women have an orgasm. And you should definitely do that. And then, you know, I would also say that I would want to make sure that person really knows the biology of the clitoris. That would be key because I would want to know whether or not she has really understood that the clitoris is not just a tiny little thing that we know as sort of this button at the top. And I'm sure you see all the time that people have no idea the shape of a clitoris. So if you don't know, Google it right after this and see what a clitoris really looks like.
Well, you guys, it's 9:40 Eastern time, and there are a ton of you still on this webinar. So, Brooke, what if we give them another 5 minutes of questions? What do you think? I know y'all want to go to bed, and I know people are staying because they are hungry for this information. And so if you fill out that survey, which is in the webinar chat, please let us know. What do you want to hear more of? What can we do more of? What other ideas do you have? I'm so thrilled all of you have been with us for this long stretch. So we're getting questions about depression. Depression is really killing my sex life, or other questions of my antidepressants are really killing my sex life. What do we say to people with depression? How can we have a great sex life when we're sort of not thriving in other ways?
First of all, you have to treat the depression first, right? There's just no way. But I would also look at the ways in which I would focus less on sex and simply more on comfort, connection. Those touch is good for depression. You know, you said earlier, no one has ever died from not having an orgasm, but people actually have died from not being touched. So I would focus not necessarily on sex, but simply connecting with your partner so that you do kind of feel safe and taken care of around that. The other piece, of course, is that there are so many new antidepressants, and there really are some now that don't have a lot of the sexual side effects. And so I would definitely encourage you to find, in general, if your antidepressants aren't working, you know, some new meds, and also some that really don't decrease.
Yeah. And for those of you who are on here with what we call PSSD, post-SSRI-induced sexual dysfunction, please know this is devastating. It is horrible to have taken a medication that can cause sometimes irreversible sexual side effects. It is devastating. And the medical community has not done enough to do the research on this topic and to come up with solutions to make this better. Now, we've had success with dopamine boosting agents like flibanserin, like Vyleesi, like combination therapy with ED meds or PD-5 inhibitors, the right devices, the right hormones. We've had successes, but it is not easy, nor is it a one-size-fits-all quick fix. And so again, you matter, your story matters, and you deserve to work with a team. And it's often a team that will get you as much quality as possible for you, because we can't fix all of the biology because some of it is unknown. But that's why, again, we work on research, we work on advocacy, because we must raise awareness about all medicine can have side effects, and not every medicine has known side effects, which is why we have to keep talking and asking the questions. Let's see. Ooh, we're getting a lot of questions on ethical porn and what your feelings are. What are good ways? And some people like to listen, some people like to watch, some people like to read. Give us and I know we'll have a lot of things in the resources, but give us a quick spiel on ethical porn.
Yeah, a lot of people are really kind of tired of porn that is performative and does not treat the sex workers, you know, equally. And there's, you know, sort of all these terrible things that people feel about kind of regular porn. And so ethical porn has become really big. And there are a lot of sites that cater to women. There's, you know, feminist porn. There's a lot of porn now that is geared toward Black and brown people, gay and lesbian, bisexual, transgender people. So I think ethically we're really, you know, moving in the right direction. And yes, we do kind of give some resources on that. But again, I say whatever is going to allow you to enjoy what you're watching or listening to. And I really, really want to stress that erotica, especially for women who think, I think porn is gross. I hate it all. I don't like it. Please, look up erotica, read the sexy novels. It's not, there are so many more, as you said. My patients keep coming in and telling me about all these sexy things they're reading. And they are amazing because what we do know is that a lot of women are not as visual as men. And so they like a little mystery. They like to hear it. And I really encourage people, if you want to have sex with your partner when you get home, or maybe you already scheduled it, listen to erotica on your way home from work. Get in the mood before you've even walked in the door. So there are all these wonderful things. And I, of course, totally support ethical porn and watching something that you feel good about.
I love all of this, and I just heard from my team that more than 60 of you have already signed up, given us your feedback, and signed up for this raffle. So we're going to put the link again in the chat box for those of you who did not answer. We want you to get a device raffled off to you. Maybe we'll get a few more donated. Go into your little emojis, the reactions at the bottom. Give us a heart or a thumbs up or a big boo if you didn't like this. Tell us, keep telling us what we've done, good and bad, because we can only get better at this. Just like sex, we can get better at webinars, y'all. So I want to share what somebody, I want to finish with what somebody just commented, and I want to tell a story because I think stories give us hope. So someone commented that all of this just seems like so much effort when I honestly don't care about it. I'm in this webinar largely for my partner, and I'm here and he's not. Another thing I'm trying to take care of. I haven't enjoyed sex for many years, and now it's becoming painful. I feel like I could live the rest of my life without it. It's my lowest personal priority, but I don't want to get divorced. I hear you. I see you. We all do. You are many people. You are not just you. You literally keep my life going because this is what we see all day, every day. So first of all, we hear like this is you're not special. You are special in many ways, but this is so common. And we see miracles. I see miracles every single day in our practice when we take someone who is empty, has an empty gas tank. It is just so empty. And we get to know them and we understand what's going on. We teach them about the biology and they start learning for them. They say, oh, I didn't know that was where my clitoris was. Oh, I didn't know my labia started to disappear in menopause. Oh, I didn't know that the part that you pee through actually changes with menopause, and that's why I get up at night to pee, and that's why I'm getting UTIs. Huh. I didn't know all of these things. And they start reading and they start learning and they start feeling better because we help add some gas back into their tank. And then they get their partners interested in it because the biology is easier to talk about. And then they come back and see me and through working together slowly, getting them a sex therapist, getting them a pelvic floor physical therapist, getting them a team that deeply cares about you, not just a partner that cares about you, but a whole team that is lifting you up and getting you to feel whole again and putting gas back into your tank. And that's when people come back to me and they say, oh, Dr. Rubin, I came to see you for pain with sex. And yeah, it doesn't hurt anymore. But I didn't think I would like it again. I didn't think I would want it again. I didn't ask you for that. And so you showed up to this webinar because something you wanted more, something felt like it was missing, and you showed up. Now, it would be wonderful if you could share this with your partner and use this as a building block to have those conversations with your partner. But please know that you are not broken, that there is so much out there that we can help you with. And if it's not a priority, put it away. That's okay. But you showed up tonight. You showed up tonight for a reason. And so if there is anything that we can do to help or the community can do to help, we're going to give you those resources. We're going to help you. And please understand that there are things that you can do in your toolbox if you have the time and the energy to do them. So I will finish there. I think we are just, gosh, Brooke, can you believe this night? This is
So
this
much.
is the best Valentine's Day ever.
It is. Thank you for
I'm
spending
I'm usually so anti-Valentine's Day, and Brooke was like, we got to do something. I was like, I don't like doing things on Valentine's Day. She go, we got to do something. And I'm so glad we did. I'm so glad. See, it's like sex. You don't want to do it. You don't put it, but we put this on the calendar. I had to show up. And it turned out great. And it's just what a wonderful evening. I learned so much.
I'm glad it was fun. Thank you.
All right, everyone, we are going to send you resources. We're going to keep in touch. We're going to make sure that you have what you need. And everyone, have a wonderful evening. Thank you so much.